for the highest one you can get. All right, we're going to get started. Good morning to everybody here in Erie. Good morning to the folks in Pittsburgh. Especially in Pittsburgh, if you don't have, you have trouble seeing the screen or anything comes up like that, please let us know. Does everybody, Crystal, benefit booklets for Pittsburgh? Okay. Okay. So everybody here, you all got this benefit booklet? Okay. And in Pittsburgh, you're going to get your benefit booklet. They should show up tomorrow. And what we're going to do today is talk about the health and welfare plan, my personal favorite subject. Not really. Every year comes around and we have to decide if we're going to have a meeting or not. Is there any changes going on this year or not? Well, this year, there's big changes going on. So when you walk out today, we want to make sure you take a couple of things, capture a couple of things in mind. And that's the first one. Big changes to the health and welfare plan for this plan year. All right? Now, why did we make big changes? Well, we certainly didn't do it to make it easier for Crystal or Dave Jackal or our accounting department. There's a couple of drivers to it. Number one, anyone that's in Western Pennsylvania, over the last 3, 4, or 5 years, you've heard about this battle between UPMC and the Allegheny Health Network, or Highmark. Okay? That battle has complicated our health and welfare plan for years. The state of Pennsylvania, through the courts, ended up basically pressing those guys to sign what's called a consent decree, several consent decrees, and they're going to start to expire. So this complication is probably going to get even more complicated. That's one driver. But actually the main driver, the reason that we're making the change that we are this year, is because of cost. The easy thing for us would be to go and buy a fully insured plan. To go out and buy a plan from Aetna and say, okay, guys, this is what the cost is going to be. The reason we're not doing that is because your cost would go up and Modern's cost would go up. So we're making the changes we are basically to protect your costs and because our plan is becoming unmanageable with the way the hospitals are dealing with each other. So you might see a few new faces in the room. Rick Medrano is with a company called Entrust. And so by way of introduction, that's why he's here. And Rick is actually going to do a lot of the presenting today to explain the changes in our health and welfare plan. Rick, take it away.
Thanks. All right, let's see.
This was where
okay, while he's getting that on or fixed up, this is what I'm going to use. So if you can find this one document, I know there's several other documents and stuff in here, but this is for the presentation. This is what we're going to review. And then at the end, there's going to be an enrollment application. Eric from Entrust in the back and Crystal are putting stickers on them for you so that you don't have to spend as much time completing them. So we'll go over that at the end. But for now, let's look at this one, but yeah, take your time. Okay, so you've done the introductions. New services and benefits for 2016. Entrust, we're a third-party administrator. Okay, we're not an insurance company. We're not an Aetna or a Cigna or a United, Blue Cross. We are a third-party administrator. We're not a network of doctors. Okay, so when you use this program, you're not going to ask the doctor, do you accept Entrust? Because they're going to tell you no. Because again, we're not a network of doctors. And I'll explain what you need to ask. The changes that we're going to review take effect April 1st. That is when your plan, these changes, and everything that's going to happen on April 1st. This is your open enrollment period. Health Advocate is going to play a very big part in your new benefits. We've listed there. It's on the easel next to Dave, and you're going to see it throughout this document. They're the customer service arm of Entrust. So when you're going to call Entrust, you're going to be calling Health Advocate. You're only going to have one card. Right now, you probably have multiple cards, right? Prescription, inpatient, doctors. You're only going to get one card from Entrust. It's only going to have one number. Even though there are multiple vendors, attached to your health insurance program. You're going to have a PPO network, a new one. You have your prescription benefits. You've got your utilization review that does the pre-authorizations. But all of that is tied into a health advocate. So one number, regardless of what you're calling for, whether you're calling for benefits, you need to find a doctor, it doesn't matter, one number, and they're going to be available Monday through Saturday, not Friday. Monday through Saturday till 6, not till, they're going to stay available till 9 p.m. Eastern Time. Okay, so they don't operate on normal business hours. Most, after 5 o'clock, you can't get a hold of a live representative. But with the health advocate, until 9 p.m., and that includes Saturdays. So we'll talk more about their importance, because there's something else that they do that is, if you're going to make this plan work for you, it's going to be because of health advocate. MediBid is a vendor, and we list it separately because when it comes to having a surgery, and most of you, probably everybody in this room, is not going to be faced with a surgery next year. I hope you're not. But if you are, then you probably want to consider MediBid as an option, and I'll explain who they are and what they do and how they can minimize your out-of-pocket to where the surgery costs you nothing, zero. The plan pays 100% of it. The benefit guide walkthrough, new benefit plan, that's what we're going to do here. One-stop shopping, that ties back to health advocate, only one card, one number. The informed employee, the portal, mobile app, there's a page dedicated to that in this benefit guide, so we'll go through that. But it's a web portal that we've designed. It's going to be customized for modern industries. And then the last thing we're going to do at the end of the presentation, Krista will pass out your enrollment apps, and then we'll go over that real briefly. Now, the enrollment apps, everyone will need to complete one. Okay, even if you don't want to participate in the plan because perhaps you're going to stay on your spouse's plan and take advantage of a spousal perk. Well, we still need you to complete one. And if you can complete it today, great, we can help you. At the very latest, next Tuesday, Dave and Crystal need your applications turned in by next Tuesday. Okay, let's go ahead and let's turn to page 2.
Yeah, this presentation is following the guide. And the ones you have here, and here you have the paper.
Yeah.
Guys, there's some loose leaf inserts. You can take those out, and the page numbers are on the bottom. So turn to page 2. That's what you're seeing on the screen now.
So if you open up the book, first thing it says is welcome to your benefit guide for coverage effective April 1st. We've done the introductions. And right off the bat, we start out with health advocate. Because again, you're going to see how important of a role health advocate is going to play for you, especially if you have to seek services in a hospital. Okay. Doctor visits and things like that, no big deal. But if you're going to have major services, health advocate is going to play a major role. Waiting period is the first of the month following 60 days of employment, but that only applies to new employees. You all are not new employees. I'm assuming everybody's on the health plan. Then you're going to be effective April 1st. This waiting period doesn't apply to you. There's no lapse in your coverage. Okay? But if somebody got hired today by Modern Industries and today's their first day of employment, they're not going to be effective April 1st. They got to go through that waiting period. The next 2 categories, making changes during the year and qualifying events. You cannot make a change during the year. The IRS doesn't allow you to. So let's say you don't sign up your spouse today, but 4 months from now your spouse becomes ill and you want to sign up your spouse 4 months into the new year, into the plan year, that's not allowed. You know, that's an IRS guide. That's not an Entrust rule. That's not a Modern Industries rule. That's an IRS rule. Now, the IRS goes a step further, and they do provide you for some exceptions, and those are the qualifying events. You get married. You can bring your spouse on 30 days from the date of your marriage. You don't have to wait until next April. Birth of a child, same thing. Adoption of a child. You can bring them on mid-year. Maybe your wife's covered, and your wife mid-year loses her job, or maybe she goes part-time and she's no longer eligible for her benefits. That's a qualifying event. So lots of coverage allows you to bring your spouse on within 30 days. So there are some exceptions to the rule. And then network information. Right now, you have a PPO network for your doctors, and that is called Vantage. Effective April 1st, the network is changing to a company, or the network is called First Health. Very important. First Health is a network. They're not new. They're not regional. They are in all 50 states, and they are owned by Aetna. Okay, so it's not a small network. It's probably one of the top 3 largest networks in the country. And for you guys, we did an analysis specific to Erie. We looked at all your other locations, Kersey, Pittsburgh. 95% of the providers are in the First Health Network. So you're not going to have a problem finding First Health providers. Okay, now, we gave you the web address, firsthealthprofessionalnetwork.com, and the reason we do that is I'm sure most of you have an established relationship with the family doctor. Go online today or tomorrow or this week, make sure that your doctor participates. Make sure that, because again, 95% of them we've already confirmed do. But if you find yourself in that 5% where your doctor's not taking the network, doesn't accept it, let us know, and we will be more than happy to reach out to First Health so that they, in turn, can reach out to your doctor and at least start the process of trying to get them enrolled into their network. Okay, that process can take 30, 45 days. Okay, now let's go to page 3. The benefits are changing. Right now you've got a deductible. Your deductible is going away April 1st. And it is being replaced by, if you look at the very top, it says coinsurance. Maximum, it's a 40% monthly coinsurance of the first $1,250 per individual per month. 40% monthly coinsurance of the first $2,500 per family per month. So 40% of $1,250 in any given month is your responsibility. What is that? That's $500. That could be your, now, to get to $500, you have to have over $1,250 in expenses, obviously. If all you do is go to a doctor, that's $100, you're going to pay $40 for that. So you could get to $500, but you're going to have to probably have a surgery to get there in any given month. You're not going to get there by going to doctor visits because doctor visits don't cost $1,200. They cost about $100, $150. So don't think that, oh my gosh, I got to pay $500. No, you're going to be paying 40% of whatever the cost is up to $500, and then you're at 100% the rest of that month. I don't want you to think that you got to pay the first $500 before the benefits kick in. No, you're going to be paying 40%, not to exceed $500. Chances are you're never going to get to $500 unless you have a heck of a lot of physician visits, or you have surgery, or something high dollar like an MRI or a CAT scan. Otherwise, let's take the example of a physician office visit. If it's $150, but the doctor is in the First Health Network and they've agreed to accept $100, you're responsible for $40. That's it. You want to go get your routine exam? You don't pay anything. It's covered at 100%.
The preventive care, you mean?
The preventive care. Urgent care facilities. Those are the minor emergency clinics, 40%. I would never go to an emergency room if I could go to an urgent care instead. I'm definitely going to be saving money. If I go to the emergency room, I'm going to spend $500 because those are $4,000 or $5,000 a pop. Now, you do have an annual cap as well. So let's say that you do spend $500 every month. Let's say that you do have a surgery or you're in the hospital 4 times, 5 times, whatever. Your annual cap's out at $2,000. See that up there? So you'd have to hit 500 4 times. The likelihood is very small if that's going to happen. If you cover your family, then it doubles to $4,000. Okay, so that's your maximum in any given month, 500. Your maximum in any given year is 2,000. If you cover your family, the maximum in any given month is 1,000. The maximum in a year is 4,000. Okay. This is just a continuation of your day-to-day expenses. You always want to stay in the First Health Network for the doctor visits, and then up in the top it says lab and radiology, which are x-rays, allergy injections, chiro, mental health, substance abuse, emergency room physicians. All those doctor visits and labs are 40%. As long as you stay in the First Health Network, you're never going to get balance billed anything beyond your 40% responsibility of those discounted allowed amounts. Now, if you go out of network to a doctor or a lab or a radiologist that doesn't participate in the First Health Network, you could be facing additional amounts beyond your 40%. Because on this side, in this column, where it's not a First Health provider, it's subject to the plan allowable. What if this doctor got to accept whatever we give them? If they're under contract. These doctors don't. They're not on anybody's network. They can bill $300 for an office visit if they want to. There's nothing you can do about it except quit going to them. because your plan's only going to pay 40% of the allowable. And the allowable is not going to be $350 for an office visit. It's going to be Medicare plus 130%. That's what we established the allowable for this plan. 30% more, we're going to give those doctors 30% more than Medicare's given them. Now, if they decide they want to be greedy and bill you 200% above Medicare, then you've got a decision to make. You either quit going to that doctor and try to find a doctor in the First Health Network, or you're going to be possibly paying more than your 40%. So stay out of that third column. In other words, don't use doctors that are not in the First Health Network. And that's the question you're going to ask. When you go to a doctor, do you accept First Health, not do you take Entrust? Okay, now, for the majority of you in the room that are going to be enrolled in the health insurance program, I just reviewed the day-to-day basic doctoring services, which is probably what 85% of you are going to use your health insurance for next year. That's it. Most of you are never going to use the services that we're about to go through next. And those are the major medical procedures, the hospitalizations. I hope none of you have to go to the facilities. But if you do, it works a little bit differently than the ones that the benefits that I just reviewed. The benefits I just reviewed are tied to the First Health Network. But once you start getting into major medical expenses and you have to go to the hospital, there is no network. The First Health Network is not tied into the facility covered services. There is no line here that says First Health and non-network. It's just, you're free to go to any hospital.
Right, but Rick, if I have to go to a hospital, which ones are in which network? That's what I don't understand.
You can go to any hospital in the country. The network doesn't apply. Okay, there is no network. With the doctor visits and the labs, you obviously want to stay with First Health. But here, you're open to go to any doctor. It's called open access. Okay, you're not tied to a network. You don't have to go, oh, well, I've got to find out hospitals that take First Health. No, not all hospitals. But you got to be careful because since there is no network, there's no discounts and no contracts in place where they have to write off the discounts and not balance bill you. Hospitals can balance bill you if they want. But we are going to stop that or try to stop that by using Health Advocate. Because every one of them still say 40%, and you know that you're capped out at $500. Let's say you have a $100,000 hospital visit. 40% of $100,000 is $40,000. But remember, going back to that first page, your maximum liability in any given month is $500. However, anything that goes above the plan allowable, you're responsible for. That $500 is only subject to the plan allowable. So that's where we got to be careful. The allowable for facilities is Medicare plus 170%. That's more than reasonable. We're telling the hospitals, you're getting this from Medicare for a patient that's over 65. The Medicare's paying you this. Our health plan is going to pay you 70% more than that. That's pretty reasonable. But some hospitals like to charge 200% of Medicare. I've seen some that go to 1,000% of Medicare, which is a problem. I mean, hospitals are the problem. It's not the insurance. It's the hospitals that want to charge 1,000% more than Medicare pays them. So how do we circumvent that? Well, if you know you're going to have a surgical procedure, let's say that you're going to need knee surgery, and you've gone to your doctor says, yeah, I'm going to send you to an orthopedic surgeon. We're going to schedule that knee surgery. The first thing you should do is call Health Advocate. And they're going to find out who your surgeon is, what facility they're proposing to do the surgical the process or the procedure. They're going to try to negotiate all of this in advance of you ever having your surgery, so that by the time you walk in that morning for your surgery, they already have an agreement in place with that hospital, with the doctor, with the anesthesiologist to accept your plan allowable. So you know that you're liable for just what, $500. And there's no surprises. But on the flip side, if you go in for your knee surgery and you don't pick up the phone and call Health Advocate, that's all we're asking you to do is pick up the phone and call Health Advocate. We're not asking you to negotiate the deal. We're just asking you to call them, let them do it. But if you forget to do it and you don't want to do it, and you go in for your surgery and you get this bill and you're saying, why am I getting this $2,500 balance bill from the hospital? Why is the plan not paying for it? Well, we're going to pay up to the plan allowable, 60%. We're going to say, well, did you call Health Advocate? No. That's probably why. We didn't get a chance to negotiate with that facility in advance.
So, Rick, is pre-certification required before hospital visits?
yeah, it's still a requirement like it is on your plan today. With Health Advocate, the requirement of the plan is to try to do your pre-authorization 5 days before you have a surgery. But because Health Advocate needs some time to negotiate in your behalf, we would like for you to give us at least a 10-day notice if you know you're going to have an elective procedure. Now, there's going to be situations where emergency happens. You don't have time to call Health Advocate. You have an emergency, you're in the hospital, they're admitting you from the emergency room into the hospital. The last thing on your mind is insurance. The last thing on your mind is Health Advocate. So what do you do? Because they're not going to be able to negotiate in emergency situations on the front end. So what happens there, because it's out of your control, you're going to get whatever services done that you need to do, and then the bills are going to come to Entrust. We're going to process them. We're going to apply the plan provisions, 170% of Medicare. We're going to pay 60%. Then you're going to get bills. And if it exceeds the 40% difference, that means that they billed in excess of your plan's allowance. What you need to do then is call Health Advocate, because they will, on the back end, it's not a lost cause. On the back end, they will negotiate with the provider, even though it's already happened, to try to reduce a settlement and to minimize your out-of-pocket financial liability. So it's not all, it doesn't sound to me like, I've seen a huge success rate with Health Advocate negotiating on the back end.
So you said pre-authorization is required if I know I'm going to have surgery?
Yes.
So in an emergency case, do I still have to call them?
Yes. Yeah. The way it works with emergencies is normally after you're admitted through the emergency room into a hospital, you've got 2 business days. Usually it's your attending physician, your doctor, or a member of your family, but somebody still needs to call within 2 business days after an emergency admit to have it pre-authorized. And that way now you've got Health Advocate on the hook, and they're starting to work, even though you're still in the hospital. They're already calling the hospital.
So by way of some examples, I wanted to, this whole idea of, wait a minute, I don't have deductibles anymore. I've got this monthly capped co-insurance. How the heck does that work? I don't know about you guys. We've been working on this thing for close to 9 months, several of us at Modern. So it takes a little bit to get your head around. Here's an example. If you look at the orange colored, the red or orange colored column. All right, in January, this is an example of a family plan. You've got 4 people on the family. And in this case, I'll call it a bad plan year. A bad plan year means you racked up a lot of bills. Okay? You know how things go. You'll have fine, you'll have hardly anything, and all of a sudden you had a bad year. This happened, that happened. So let's look at a bad plan year. In January, you had $1,200 worth of bills. Well, yeah, one kid went to the doctor, but then the other kid tripped, hurt his elbow using a cast, whatever. So $1,200 worth of bills. You get into March, $700. Several doctor visits, some treatments, some medications add up to that. Here comes into April. What happened? One of the kids got really, really sick and had to spend 3 days in the hospital. $30,000. That's not uncommon. Continue on down. May wasn't a whole lot better, still $1,200 worth of charges, and it continues on down through. So what is the comparison between Modern's current plan, in this case, this catastrophic, this severe case, and the new plan? Under the old plan, if you look at the far right-hand column, that's $1,200 in January. It depends on how that money comes, okay? If it was $1,200 for one person, you're on the hook for you're on the hook for a lot of it, because you have a deductible in place. That's not the way the bills usually occur. All right? So under our existing scenario, you would have been on the hook for $695, in March, $263, etc. You got to April, you're still paying $950. You haven't met the deductibles and co-pays yet. Now you'll see on the far right-hand column under our plan, when you get down below that, you've met all the deductibles and co-pays. Yes, it's kicking in at a higher level. And the bottom line here is the total claims total out of pocket, if that's my family, is $2,800, $2,829. Now on the left, that's our new plan. So you get into January, $1,200 worth of claims paid. What's my responsibility? 40% of $1,200 is $480. In March, $700. 40% of that's $280. Now comes into April, the bad, super bad month. Somebody was hospitalized. That could be 30, that could be 50, $60,000. You're going to cap out on that monthly cap of $1,000 per family. Again, it's 500 per single, 1,000 per family. Come into May, again, I'm at 40%, 40%. And at the end, the total claims, $29.88. That's a little bit, in this severe case, a little bit higher than Modern's old plan. Well, let's look at a little bit more realistic example. On this slide at the bottom, this is that same catastrophic claim. And just to show you, where's your total? What if it was even worse than that? Well, in the dark green bar, you see $2,829 under the current plan, $29.88 under the new plan, and that's against these caps. $4,000 under the new plan for a family, annual cap, and $3,600 under the old plan. Well, let's look at something a little more typical. Family of four, this upper portion shows day-to-day type claims. Now, total claims are in the $4,000 rate, $4,400. It doesn't take that much to add up to that. I don't know if I would call that average. It might still be higher than average. Okay, you can hit that. Again, you're adding up prescriptions, doctor visits. Maybe somebody needs crutches, whatever. Continue on down. You look in the dark green bar. In that scenario, more typical, Modern's current plan, because of deductibles and copays, is going to charge you total out-of-pocket $1,940. The new plan would only cost you $1,700 out-of-pocket. Let's take an extreme example. Let's say I have single coverage. Extreme example. If I only go to the doctor once a year, in Rick's example, he said, the doctor's going to bill $150. They're in a network, and in that network, under our existing, it's Vantage. Under the new, it's First Health. That network charge is going to be discounted to $100. Under our existing plan, how much are you going to have to pay if you're in Modern? It happens right after the beginning of the plan year. It happens April 2nd. You have to see a doctor. Under the existing plan, you have to pay the $100 because you haven't met your deductible yet. Under the new plan, you pay $40. You start off from the first dollars and you're paying only 40%. That's an extreme light example. Somebody just sees a doctor once. Here's for single coverage again. The bottom half of this is showing an extreme example, an individual having over $30,000 worth of claims. And do you see the difference? Yes, the new plan, good cost, shows here the way these particular claims came in as being a little higher. Under a more typical scenario, for a single person, $1,000 worth of claims. And I had to see the doctor a couple times during the year. I've got a prescription that goes on every month. $1,000 worth of claims, maybe higher than average, but it's more common. In that scenario, our old plan would have cost you $548 out of pocket. The new plan would be $427. Now, how is this new plan going to work out for you in this new plan year? Nobody knows. We've done a lot of research. We believe that this is going to work out for you and for the company pretty close to the way our old plan did. And depending on the scenario, you may be further ahead. We don't think you're going to be much further behind or much further out of pocket.
Okay, the prescription drug benefit, you get generics, brand names, specialty drug, and then you got the Affordable Care Act, where required preventive medications. You can go to any pharmacy of your choice, even though it says CVS Pharmacies up here or CVS Caremark. That is the name of your pharmacy benefit manager. It's currently Health Smart RX. But after April 1st, it's changing to Caremark CVS. But that doesn't mean anything to you as far as what pharmacies you can go to. You can continue to use your pharmacy of choice. For a 30-day supply of generic, it's $12. Unless you can get it like at Walmart for $4, I would do that. But otherwise, and there's a big list on those $4 from Walmart. Otherwise, you're going to pay $12 for a 30-day supply. 40% is the copay. It's not a flat dollar amount. It's a coinsurance. It's a percentage. So you have to shop for your brand name drugs because you don't know what that cost is. It's different from pharmacy to pharmacy. You're responsible for 40% of it. Now, your 40% that you do pay for brand name drugs does apply to your monthly cap of $500 for that particular month. So if you had satisfied it with a surgery and you need brand name drugs, you get them for free for that month if your $500 has already been met. And that goes with any services for that matter. But on the current prescription program you have right now, it's in place today, you can only get a 90-day supply of prescriptions through mail order. And the only types of medications that are available for a 90-day supply are maintenance. That would be prescriptions for the treatment of cholesterol, prescriptions for the treatment of hypertension. Those are the types of medications you take every day for the rest of your life. You can't just get them because you want them. Your doctor has to write you a prescription that allows you to get a 90-day supply at a time. But going forward, your options are retail 90 or mail order. You can continue to do the mail order for the 90-day supplies. You've got to complete a new application through CVS Caremark, and I'll get you those applications. But why do that when you can now get your 90-day supply direct from the pharmacy? So when you go get your prescriptions, you give the pharmacist your 90-day prescription, pick up the 90-day from the pharmacy window, the counter. You don't have to go through mail order anymore. So to me, if I had a choice of going through mail order and waiting a couple of weeks, or just going and getting at the pharmacy the day I get the prescription, I'd do that way. I would get it at the pharmacy. And so that's available to you after April 1st.
And that is new.
That's new. And you've never been able to get 90 days at the pharmacy. Now, you'll also save some money. You'll notice the copay for a 30-day supply is $12. So if you don't get your doctor to write you a 90-day script, assuming you're taking maintenance, over a course of 90 days, you'll want to pay in $12 times 3. That's $36. Whereas if you get a 90-day script, you can get them for $25, which is an $11 savings. I mean, it's not a lot, but still, it is a savings over that 3-month period. Same thing with the brand names. Even though it says 40%, let's say a 30-day supply runs $100. So if you get 30 times 3, that's $300. But if your doctor writes you a prescription for 90, you might get them for $250. And so you're paying 40% of a lower dollar amount over the course of 90 days. Specialty drugs are not available at the pharmacy. Those are only available through what we call the specialty pharmacy because they're high dollar. Some of the specialty drugs are $120,000 for a 4-month supply. There's examples are like treatment of hepatitis C, Hep C. Some of the rheumatoid arthritis injections run about $5,000 a month. Treatment for multiple sclerosis runs about $3,500 a month. Those are very expensive drugs. They're available, but you've got to go to the specialty pharmacy. And then you've got, but you can't lose, or remember, you've got My Modern Meds. Can't lose sight of that.
So My Modern Meds, if you've used it, you know how good it is. If you haven't, just a reminder for it. If you have a maintenance prescription, again, high blood pressure, cholesterol, something you're going to take month after month. If the doctor may try you on this generic or that generic or different things and say, hey, these don't work. These don't work for you, Dave. You have to use the brand name. They will write the prescription as do not substitute or dispense as written. If they do that on a maintenance drug, okay, you want to contact My Modern Meds. You want to look this up on the web because by doing that you can look in their formulary. My Modern Meds has not changed, but the formulary has. There are drugs that didn't used to be a part of that are part of it now. Well, why do I want to use My Modern Meds? Because I get $0 copay. So if it's a maintenance drug, it has to be the brand name. Please look at My Modern Meds because you can get that at $0 copay. Big savings for you. I started out today by saying there's big changes. And then a little bit ago, I said, you know what? We don't know exactly how this is going to pan out. We're going to go forward with it. Well, Modern's going to take this risk. We think it's going to be about the same kind of cost. So what does that mean for your employee contribution, the amount coming out of your check for this? We are keeping it exactly as it has been. So we're keeping the employee contribution, the amount you pay, exactly as it has been. So, well, wait a minute, the MERP dollars are the wellness dollars are part of that. Yes, they are part of that. So let's say I have family coverage, which I do, and I have 3 wellness points. Whatever I was paying in January, February, March with family coverage and 3 wellness points is the same I'm going to pay in April, May, June, going into the new plan year. Now, if the July screening comes up in the program and I get more points, I'll get a bigger discount. If I lose points, I'll have a smaller discount. But for right now, we are not changing. We're confident enough in this program that we're leaving your employee contributions alone.
All right, just real quick, this is the web portal that I mentioned in the very first slide. And it'll be available to all of you who enroll in the plan, but not until about May, the first week in May. So we just give you the login instructions. But once you've logged in and you've created your user ID and your password, you can go look at your claims online. You can look for the doctors in the First Health Network online. You can, if you lose an ID card and you need a new one, you can do that online. A plan document will be online. All this paper you have in your hands, it's going to be all loaded online. So all that's available to you. You can ask questions online, type in the question, you'll get an answer back. There's also a phone app available, so if you got your smartphone, you'll have your ID card on the phone loaded. You can email it to your doctor if you've lost your phone. I mean, if you lost your ID card, it's always available on your phone. Just download the phone app, and you can access your ID card that way.
So Rick, if you have a dumb phone like I do, what do I do? Am I going to get a new card?
Yeah, everybody's going to get a new card. If you enroll in the health plan, you're going to get a plan. It looks just kind of similar to the one you have. It's white with the red trim, and you'll have them since we're still in February, and this takes effect in April. You'll have your hard plastic ID cards before April 1. Okay, it's just additional online web tools. Now, these are the 3 vendors that are very important. MediBid, I didn't talk about them really, but when we were talking about major medical, remember I said call health advocates so they can negotiate with the surgeon and the hospital and everybody in advance so that you're not stuck with more than a $500 bill? Well, MediBid goes one step further. MediBid, let's say that you call health advocate. You say, okay, that's great. You've worked out an arrangement at St. Vincent or at Hammett, and it's going to run me, I'm going to wind up paying about $700 at the end of the day. What options do I have through MediBid? MediBid is when you're going to have surgery. So using the example I used earlier, a knee surgery, they're going to go out and get medical bids. Bids. You know, like somebody's bidding for work. These doctors are submitting bids hoping that you'll select them to do your surgery. Right? That's the way it works. And you're going to get multiple bids. And what MediBid does is they go out and they put a package together which includes the facility, the surgeon, the anesthesiologist, the assistant surgeon, pathologist, everybody that's associated, all the different providers that are associated with that. I promise, when you go to have a surgery done, there's multiple providers. You're going to get hit with 5 or 6 or 7 bills. But with MediBid, you only get one because they wrap it all in one package. And if you accept their bid, then it's free. Your surgery's free. You don't have to pay not even the 40%. It's free. The plan's going to waive your 40% and pay it at 100%. Now, these surgeons are board certified. They're not like bottom-of-the-barrel surgeons. I don't want you to think that, because MediBid obviously is not going to give you a bid on a surgeon who's going to put them in a liability situation. So they're all board certified. They're not on any kind of a list for lawsuits or anything like that. They'll actually, the bid, when you get the bids, they'll show you the success rates of that physician, and they will show you how many times that surgeon has performed your surgery, the one that your proposed surgery. Now, one thing is the bids are not just specific to your area. They may say, drive down to Pittsburgh for your surgery. Okay, and then that's going to be a 2.5-hour drive from here from Erie. But if that package comes below the accepted, remember the accepted is Medicare plus 170. If they can achieve a package that comes in below, then there's money in there that will help you with your travel expenses. As long as it doesn't exceed the plan's allowable, you may have a stipend to take care of your hotel in Pittsburgh.
So let's take that into an example. So let's say my knee's been bothering me, and I told the doctor about it a year or 2 ago, and the doctor says, you know what, when it's bad enough for surgery, you'll come back to me. So eventually, I can't even sleep at night, the thing hurts so bad. I go back to the doctor, he says, yeah, you're due for surgery, sends me over to Dr. John, the orthopedic surgeon, and he checks it out and says, oh yeah, you need this arthroscopic surgery. Well, I'm going to call Health Advocate. When I call Health Advocate, they're going to say, okay, what are you supposed to have done? And I tell them who's the doctor, who's the surgeon. They're going to say, hey, you're in Erie, Pennsylvania. There's 3 hospitals around. Where would you like to have it done? I don't know. I never had knee surgery in my life, so all I know is I've heard people talk really well about St. Vincent's. They say it's a good place, so I want to have it at St. Vincent's. Okay, we'll get back to you. So they call me back and they say, yep, your surgery's approved, it's not an issue, and if you want to have it at St. Vincent's, you can. Now, we checked with St. Vincent's, and they told us that instead of 170% of Medicare, they wanted 180% of Medicare. What does that mean to you? After you pay your 40%, you're still going to owe them $150. Okay? They say, by the way, we know that Hammett will take 170% of Medicare, so the only thing you'd have to pay is your 40%. And they say, one other option for you is MediBid. Oh yeah? How's that go? And they explain it. So they said, well, sure, let's check out MediBid. They call me back. We look at it. I evaluate whether I want to do it, and they say, here's your other option. You have a third option now. Cleveland Clinic, by the way, does that surgery, and by the way, they do it twice as often as they do at Hammett. And if you go to Cleveland Clinic, they're accepting 150% of Medicare, and that extra money, okay, in between there is yours. And we'll cut it for you, call it travel expenses for you to drive over there and get the thing done. So it's totally up to you. If you love St. Vincent's, get it done there. You're going to have a little bit out of pocket. Or go ahead to Hammett. You'll just have to pay your 40%. Or if you decide to go over to Cleveland and have it done, oh, by the way, you don't owe any 40%. You won't owe anything. But it's your choice.
Yeah. So there's alternatives out there for you. The second vendor here, One Call Care, they are an imaging network for MRIs, CAT scans, and PET scans. That's all they do. And they've already pre-negotiated arrangements, discount arrangements, up to 70% off of the retail price, I guess. Now, and so you're really just looking at your 40%, again, because they've already negotiated what your plan accepts with these imaging centers. But in order to know which imaging centers accept that, you got to call One Call Care. Well, you don't call One Call. You actually call Health Advocate. You call Health Advocate for everything, and they connect you to these various vendors. Then the third vendor on the bottom is Medical Helpline, and that is the company that does the utilization review. We've already talked about pre-authorization is required for hospital admissions, and we also talked about it's still required even for emergency admissions 2 business days after. So you would be doing that through Medical Helpline. Medical Helpline also has what's called Ask a Nurse, which are certified case managers. They're registered nurses, and they're available 24 hours a day, 7 days a week to talk to you. And they don't treat you. They're not doctors. They're not providing. They're just giving you advice. It's a medical advice and nurse advice line. You can ask them a question. Maybe it's 2 o'clock in the morning and you're feeling a symptom and you don't know what it is. Maybe your newborn child swallowed something and you're like panicking and you're like, okay, what do I do? Do I go to the nearest emergency room? She doesn't appear to be getting a fever, doesn't appear life-threatening. You can always call Ask a Nurse, and that's completely free. And they may tell you to go to the emergency room depending on your answers.
Now, anybody that's in the dental plan or interested in the dental plan, there is no changes for the dental plan for the upcoming plan year. Okay, we added some benefits last year, no changes for this year. Your contribution, the amount out of your check for it, is not changing for this year. The vision plan is almost exactly the same, no changes. You continue to have available to you exams every year, lenses every year, frames every 2 years at 100% coverage. The only thing we did add was some additional discounts. There's some people that want to buy the polycarbonate lenses or the plastic lenses because they're lighter. Some want special tinting, and we negotiated to get some discount on that. That's the only change. And again, your employee contribution, the amount that comes out of your check for that benefit, does not change in the new plan year. Here's one thing that has changed, okay? Out of the many changes that are going on, another thing that's changed if you're in the spousal MERP. So some of this stuff, if you're in the spousal MERP, you may not have paid a lot of attention so far. You'll want to pay attention to this. The change, it goes like this. A couple of years ago, due to some changes in the law, Affordable Care Act, Modern made a change to the spousal MERP plan. We cover and reimburse deductibles and copays for our employees, but we did not cover that for the spouses. Beginning April 1st, we have reinstituted that. So if you're in the spousal MERP, you as an employee, your deductibles and copays will be reimbursed, and your spouse's deductibles and copays will be reimbursed. It was in there several years ago. It was taken out. Now it's been reinstated, put back in. The children, if there's any children covered by your spouse's plan, they've always been covered for deductibles and copays. That's not a change. The child burp, again, if you're not sure what that is, you've got a child, you're not sure how to cover them, especially if you're separated or something, ask, because we can offer you some suggestions of things that may save you money and make sure that they have real good coverage. Wellness MERP, talk about that for a minute. If you remember, the wellness MERP for the last plan year was this, $300 bucks, $100 for participating in the wellness, and $200 additional for being a non-tobacco user. In the new plan year, it's the same way. So you also will have the $300 wellness MERP, $100 for participation, $200 for non-tobacco user. As way of reminder, if you're in Modern's plan, and you have any unreimbursed expenses, which means they paid the bill, the Conifer paid so much of it, but I still had to pay 80 bucks. If you haven't applied for it yet, use your wellness MERP and get that $80 reimbursed. You have the paperwork from it. If not, we can suggest how you can get a hold of Conifer and get that paperwork and apply for it. It's cash. That's reimbursed to you. So the wellness MERP continues on. Life insurance, no change to the life insurance plan.
Okay, we're almost done. This is just a summary page. The first health is your network of providers. Remember that. Okay, for your doctors and the labs, not for hospitals, but for the day-to-day stuff that we reviewed in the beginning. Medical helpline, they're the company that does the pre-authorization review, and also they provide you with the Ask a Nurse, the nurse advice line. And they're just mirror some contact information for the MERP program, your dental insurance that has nothing to do with Entrust, but there is your contact. Same thing with vision, 401k, life insurance, your voluntary ancillary, supplemental benefits, flexible spending account. There's contact information there.
And let's talk about flexible spending for just a minute. If you've used the flexible spending accounts before, you know what it is, you know the benefits of it, and you can sign up for it after this meeting. If you haven't, let me give this little pitch for it. Okay? There's no change. The change is in who's managing it. There's no change in how it works. So if I know, for instance, I have a prescription that I have to take every month, and I know that after insurance, I'm going to have out-of-pocket expenses. I'm going to end up paying, let's say, at least $250 over the next plan year. I think it's going to be $500, but I know for sure it's going to be $250. No doubt, no question. I know I'm going to have that much out of my pocket after the insurance pays. If I sign up for the flexible spending account, which I personally do, okay, I can, by doing that, that $250 is coming out tax-free. Now, the downside of that, the IRS allows that. The IRS has a downside. The downside is if I don't use all that $250, it's gone. It's a user-to-loser proposal. So if I know I'm going to have $250 worth of expenses, and I think it's $500, I'm going to only do the FSA, the flex, for $250, because if I miss, my estimate of the other is short, then I lose that money. Okay? But the nice thing is, it's taken out, that $250 can be taken out gradually across the next 12 months, and it's tax-free. Okay, we're going to go and offer you some help. We're going to give you the enrollment forms and offer suggestions. But before we do that, let's just summarize real quickly where we're at. Here's the things I want you to take away today. Big changes to the health and welfare plan this year. If you are on Modern's plan, you will likely get a cancellation letter. So all of a sudden, you or your significant other is going to get a letter in the mail that says, by the way, you're being canceled. That can be a little scary. But that's why we're having these meetings. Yes, you're being canceled because you're going on to a new plan with Entrust. Okay? The old cards used to say Intramed years ago. Now they've been saying Conifer on them. Those, as of April 1st, will be useless. They'll be no good. You used to have two cards. You had Highmark for the hospital network, and you had Conifer for the doctors, okay, in the Vantage network. Both of those cards, as of April 1st, they're of no use. April 1st, you have one card, Entrust, and that's for everything. Now, what is the new hospital network? There isn't one. No new hospital network. If you know you're gonna be hospitalized, you know you have something that's gonna require, even if it's not overnight in the hospital, it could be same-day surgery. Remember the pre-certification, but call the health advocate. As far as the doctors go, we were in the Vantage network from Conifer before. The new network is called First Health. And those are pretty much those are the highlights of the changes. Yes. All right. So we're going to take a few minutes. Rick's going to explain the forms, and so
Crystal's going to pass out your applications.
Again, the open enrollment period is underway right now, and it ends March 1st, next Tuesday. So we're asking for you to give us these forms back by next Tuesday. We will stick around. Rick and myself and Crystal and Eric, we're going to be around, so if you have individual questions, we'll be glad to do that. If not, say you folks in Pittsburgh have some questions when you get the forms, please give us a call, and we'll help walk you through that.
Okay, just real quick, now that everybody has their application, the sticker takes care of the first part up here for you, so you don't have to complete any of that work. Now, when you get to, are you selecting coverage, you're going to check yes or no. And then if you check yes, then under major medical aid, you're going to check one of those 4 boxes. The first one being your coverage for you and you only. Then if you want to cover your spouse, it would be that second box. The third box would be you and your children. The fourth box would be you and your entire family, which spouse and kids. Then under the dental and the vision, there's only 2 options, employee and then dependents. So we don't break it out in 4 tiers like we do in the medical. And then the month, you want it or you don't want it, so check one of those boxes. Now, if you currently cover your dependents, there'll already be a sticker on section 2 on the left-hand side of that application, which answers all the questions that we need in that first column, and in the second column, and in the last 3 columns. So you don't have to mess with any of that, but I still need you to do where it says select coverage. You want to check yes under the medical, and then if you do dental, you want to check the dental and vision on each of those. And if let's say that you don't want the medical, but you want the dental and the vision, well, you're going to check no for medical, and then you're still going to check the appropriate box for the dental and the vision. Now, section 3 when you flip over the application, there's 4 questions. Those questions that you're going to answer those as the employee. We may as well go through them real quick. It won't take long to do this. But the question number 1: in addition to your existing employer's coverage, meaning this one, are you currently covered by any other group insurance program? So if you're covered maybe through your spouse and that's your secondary, then the answer is yes. But most of you, it's going to be no. This is your only insurance plan. And I don't care about the individual policies or the supplemental stuff that you might have, just only major medical insurance programs. Second question, are you currently on COBRA? I would say the answer to that one is no, unless you're paying your ex-employer money to stay on their health plan, then you're on COBRA. Otherwise, no. Are you covered by Medicare? That's question number 3, yes or no? And there's 2 parts to that number 3. If you look to the right, what about Medicaid? Yes or no? And the last question, it says, are you disabled? Yes or no? And if you answer yes, then you got to check, is it partial or full? Now, 3B, those questions are pretty much the same, so I'm not going to go over them. Now, I only need you to answer those 6 questions on 3B if you're adding your dependents or you're covering your dependents, because those questions pertain to them. If it's just individual coverage and you're covering only you, then leave those 6 questions blank. I don't need you to answer them. And then the last thing you're going to do is print your name on section 4, date, and then your signature. Now, if you check no, that you do not want to enroll in the health insurance, then you'll check one of the 10 boxes in section 5, and then again, print your name, sign it, and date it. And then you're done. And then Eric in the back will help you, and Crystal. If you want to turn them into data, you can deliver them to Eric.
We know there's a lot of information to throw at you in a short period of time. We thank you for your attention. And again, we're going to be around here, and
it's been a long day.
Call the phone, come back to us over the next several days, whatever.
Thank you all for your time. I know you're coming off a long shift, so thank you.
cooperate.
Yeah.
Hey, Jason. Sure. Sure. Let me get something. I'll be right with you.
Oh, man.